This is the Mepilex Border Post-Op AG, a dressing designed specifically for surgical incisions. It has clear borders to allow skin inspection, a flexible and highly absorbent pad, and safe-tack adhesive. This is not the adhesive you would normally find on a surgical dressing or tape. Safe-tack is designed to gently mold to the contours of the skin and minimize skin or wound damage, like blisters or maceration. In doing so, it also minimizes pain at removal. The safe-tack adhesive is hydrophobic, which means that it will not stick to something moist like the incision. Safe-tack will not disturb sutures, staples, or tape strips. And when properly applied, it will provide up to 7 days of wear time. The silver impregnated foam supports your SSI reduction strategies with an antimicrobial effect in the dressing, killing 99.9% of the pathogens. This effect is sustained up to 7 days. Now, please let me show you how flexible the dressing is. The flex cuts in the pad allow the dressing to stretch in all directions, making it conformable and comfortable, thereby minimizing disturbance to patients' physiotherapy. Now, for the application. When you apply the dressing, it is very important to first ensure that the skin is clean and completely dry. Choose a dressing size with a pad that is about 1 inch or 2 centimeters longer than the incision. If you apply it to a knee, have the leg bent between 10 and 20 degrees. Start by removing the release liner fully or halfway. Approximate the dressing over the incision with the pad overlapping the incision. You will note that there is adhesive across the whole contact surface of the dressing. This is how safe-tack protects the skin and incision. Exudate will pass through the small holes in the contact layer. The transfer layer then moves the exudate away from the wound into the absorbent pad. The dressing allows you to see strike-through right away, but the retention layer ensures that no fluid is sitting on the patient's skin. Once the exposed part of the dressing has been applied to the incision and skin, gently peel the remaining release liner without stretching the dressing. What remains now is the white window frame, which provides stability for the border edges during application and allows you to easily reposition the dressing if needed. Before removing the white window frame, ensure the dressing is adequately adhered by running your hands over the pad and the portion of the dressing that is in contact with the skin. Start at either side of the dressing on the little handle. Peel first part of the white window frame with one hand, following along with your free hand. Peel and smooth simultaneously. You will repeat this process with the remaining half. You should try to minimize wrinkles and bubbles, much like when you apply a screen protector to your phone. This will ensure the shower-proof seal. And always remember to smooth the dressing in place to secure a good adhesion across the whole dressing surface. A question we often get relates to allergies. Do not use Mepilex Border Post-Op AG on a patient that is sensitive to any of its components, including silver. It is also good to know that the dressing can stay in place during X-ray, CT scans and ultrasound MRI. Please note that you do not need to pre-wet the dressing. The silver is activated by wound fluid. To summarize, Mepilex Border Post-Op will be gentle to your patient's skin and wound. It will be flexible and comfortable, absorb well, be shower-proof, and provide a 7-day wear time with an antimicrobial effect. And when you apply it, do make sure the skin is clean and dry. Thank you. For more information, please reach out to your local Mölnlycke representative.